In many ways, the pandemic actually exposed the fragility of the healthcare system in India. So I think the first thing we can expect from the budget is to increase public healthcare expenditure, which is amongst the lowest anywhere in the world. Infrastructure needs to get a boost. More hospitals, more dispensary, more provision of care. And one of the interesting models which has been used is REITs, which is the Real Estate Investment Trust. Can we get models which give concession to healthcare REITs and make them an attractive investment opportunity? Thirdly, what we found is that virtual care during the pandemic became ubiquitous. The government itself, through the Ayushman Bharat Digital Mission, is working on giving a technological access to each and every citizen. Today, 1 in 5 startups in India is linked in some way or the other to healthcare. And these startups play a very important role because they increase accessibility and they're low cost. Can we really help build an ecosystem which will not only help our citizens, but I'm sure many other developing countries? In a post-pandemic world, as we build out our infrastructure in the healthcare space, I think public-private partnerships are required. We saw during the lockdown that mobility stopped and people had to go to the local hospitals. Can we work on this and bring in the operational efficiencies of the private sector to unlock value in government infrastructure? The second component we could look at is Bioclusters, a combination of hospitals, medtech, pharma, life sciences, which actually focuses on research and innovation. And this could be very relevant to India. It could also generate mass employment in one of the fastest growing sectors in India today. I think one of the concerns, especially in India, is the cost of healthcare. And both if we look at the pharmaceutical side as well as the medical technology side, we're still dependent on imports. Through the PLI scheme, I think the government's done a great job in giving those incentives so that production takes place locally. And I think it will address both the supply and demand imbalance which currently exists. But I think this should be looked at in the long term, where we really set up industries in these two sectors, which will ensure long-term viability and make sure that healthcare becomes more accessible as it is more affordable.